Good day, everyone. We begin with developing news from Green Valley School, where health authorities have confirmed an outbreak of infectious disease among students. Initially, several cases of measles were reported, a highly contagious viral illness. However, the situation has now become more complex. Officials have identified additional cases of varicella, also known as chickenpox, and rubella. Three infectious diseases spreading within the same school environment. This raised serious concerns among parents, teachers, and the wider community. How did this happen? How dangerous is this situation? And most importantly, what should we do to stay safe? Today, we are joined by a public health expert, Mrs. Sakar, and the headmaster of Green Valley School, Mrs. Lia. Good morning, and thank you both for being here. Mrs. Sakar, let's start from the beginning. Many parents are confused and worried. At first, we heard about measles. Now there are also cases of varicella and rubella. Why are multiple diseases appearing at the same time?
Thank you so much for the questions. So what we are seeing here is what we call a cluster of vaccine-preventable diseases. These three illnesses, including measles, varicella, and rubella, are all caused by viruses and spread very easily, especially in crowded places like schools. So when vaccination coverage is not optimal, it can create gaps in protections. And those gaps allow multiple viruses to spread at the same time.
So this is not just one outbreak, but multiple outbreaks happening simultaneously?
Yes, that's correct. And that's what makes this situation more concerning because each disease spreads quickly and together they increase the overall risk in the school environment.
Let's help our viewers understand clearly. Can you explain the difference between measles, varicella, and rubella?
Of course! Let's break it down one by one together. Okay, so the first case is measles. Okay, so measles usually begins with a high fever, cough, and also runny nose and red eyes. After a few days, a rash will appear, starting from the face and spreading down to the body. Oh, it can be very serious, especially in children, because it can lead to complications if not treated well. Complications like pneumonia or perhaps brain inflammation can happen if not be treated right. So it is very important to treat your children immediately. Yeah. And then the second one we are going to talk about is varicella. It is different than measles or chickenpox, we can say. So this disease causes an itchy rash with fluid-filled blisters. So there's some blisters in it. What's unique is that the rash appear in different stages. It has stages, okay? Some spots are new while others are already dying. Although often considered mild, it can still cause complications, especially in certain individuals. And then the last one is rubella cases. Yep, so rubella is generally milder. It causes a light rash and low-grade fever. However, it becomes very dangerous if it infects pregnant women. So it can lead to a serious birth defects in the baby, a condition known as congenital rubella syndrome. If you ever heard of it, that's it.
So even though one of them may seem mild, the overall impact can still be severe?
Yes, exactly. We should never underestimate these diseases.
Now, let's talk about prevention. Many people are asking, do vaccines protect against all three diseases?
Ooh, that's a very important question. Actually, the MMR vaccine protects against measles and rubella. For varicella, there is a separate vaccine. So in many immunization programs, children receive this vaccine as part of routine. When taken completely, these vaccines are highly effective.
Then, why are outbreaks still happening?
There are several reasons. Some children may have missed their vaccinations, right? And others might not have completed the full schedule. But there's also misinformation about vaccine safety, which has caused some parents to hesitate. And during the COVID 19 the pandemic, many routine immunizations were delayed. That's what makes herd immunity weakens. And then, when that happens, outbreaks become much more likely.
Now we turn to Mrs. Dlia, headmaster of Green Valley School. Mrs. Dlia, can you tell us what actions the school has taken since the outbreak was confirmed?
Okay, thank you so much for the opportunity. Well, our first priority, of course, is our students. So, as soon as we identify that there is confirmed cases, we immediately coordinate with the health local of authorities, and then we will identify the infected students, and if they indeed getting the infections, we ask them to stay at home so it can prevent the further spread in the future. And also, we inform all of the parents to reduce the panic, and we also conducted a deep cleaning across the school environment. So that's our efforts for that.
How did you handle vaccination records?
Okay, about vaccinations, we found that some students had an incomplete vaccinations, but not only for the measles, but also for the varicella and also the rubella itself. So we advise for those students who had an incomplete vaccinations to stay at home temporarily. So they need to follow the public health recommendations.
Some parents might feel worried or even upset about that decision.
Yeah, about the decisions, yeah, we understand that, but this is not about the punishment, but about the protections for all. So for the child, for the other students, and also for the teachers itself, the safety must always come first.
Okay, thanks, Mrs. Dlia, for the explanation. And let's back to Miss Sakar. Beyond the school, should the wider community be concerned?
Yes, especially with rubella, if the virus spreads to a pregnant woman, especially, it can have very serious consequences for unborn babies. That's why it is very, extremely important to control this outbreak as soon as possible.
So, this is not just a school issue anymore.
No. It is a public health concern. Yes.
Before we close, what practical steps should parents and students take?
Yeah, sure. Here are some important steps that you can do to your children. First, check your child's vaccination records. And second, make sure that all vaccines are complete. Third, keep your children at home if they have fever or they have a rash. And the fourth, teach proper hygiene to them, like covering coughs and washing their hands. And also, avoid contact with vulnerable individuals and seek medical attention if symptoms appear as soon as possible. Thank you.
Before we close, what practical steps should parents and students take? This situation reminds us that infectious disease can spread quickly and sometimes more than one at a time. Measles, varicella, and rubella are all preventable, but prevention depends on awareness, responsibility, and trust in accurate information. Protecting one child means protecting an entire community. Thank you to our guests for joining us today, and thank you for watching. Stay safe, stay informed, and we'll see you in the next report.
Chickenpox versus measles. What's the difference? Let's take a look. Chickenpox and measles are both viral infectious diseases. The varicella zoster virus is responsible for chickenpox, while measles is caused by the measles virus. Both diseases used to be highly common in children, but have been prevented over the years with vaccines. Measles is extremely rare nowadays compared to just a few decades back, whereas chickenpox is far more widespread. Both diseases are identified by how they affect and mark the skin. Because of this, they are often mistaken for one another. Now, let's take a look at how you can differentiate between the two: chickenpox and measles symptoms. The symptoms caused by chickenpox are a fever, headache, reduced appetite, and fatigue or tiredness. A rash that initially shows up on the back, chest, and face but can quickly spread to the rest of the body. On the other hand, the symptoms caused by measles are a rash that initially shows up around the hairline or the forehead and then spread downwards. Conjunctivitis, which results in red inflamed eyes. A hacking cough. A runny nose. A Koplik spots, which are small red dots that have blue-white centers. They line the mouth and also the cheeks. Although both diseases are identified by the rashes they cause, the appearance of the rashes is quite different. Chickenpox results in raised red bumps, which are also called as papules. These bumps can quickly turn into fluid-filled blisters that rupture and get scabbed over. On the other hand, a measles rash shows up as flat red spots. Although they can turn into bumps, they do not have any fluid inside of them. The spots run together down from the forehead as the rash spreads. Now the question is, how are they spread? Both chickenpox and measles are highly infectious and are spread by inhaling respiratory droplets. It is released by an infected person when they cough or sneeze. Chickenpox is infectious for the first 2 days after infection, just right before the rashes appear. On the other hand, measles is infectious for up to 4 days before the rashes show up and for 4 days afterward. Now, how are they treated? Treatment for both chickenpox and measles revolves around making the symptoms easier to deal with until the body deals with the infection. Doctors typically just prescribe home care, which involves resting and staying hydrated. Some over-the-counter medication can be taken to relieve fever and coughs. Moreover, you mustn't scratch the chickenpox rash as it can leave scarring. Your doctor might prescribe antihistamine medication if the rashes are too itchy. Other than that, it's all about waiting for the infections to go away.
What do you know about rubella? Rubella is an acute contagious viral infection, much like the flu. It is easily spread when an infected person coughs or sneezes, and symptoms include rash, low-grade fever, and swollen. Affect both children and adults and can have a devastating impact on a pregnant woman and their unborn babies. If a woman is infected with rubella during her first trimester of pregnancy, there is a 90% chance that her baby will be born with congenital rubella syndrome, also known as CRS. If it survives, at all birth defects from CRS include visual and hearing impairment, heart defects, and other lifelong disabilities. Rubella has been eliminated from Americas since 2015, but unfortunately, this disease remains common in many parts of the world, including areas in Africa and Southeast Asia. Currently, an estimated 105,000 children are born with CRS each year. A simple vaccine can prevent this. One dose is over 95% effective and protects a person for life. In 2001, the American Red Cross, the United Nations Foundation, U.S. Centers for Disease Control and Prevention, UNICEF, and the World Health Organization teamed up to form the Measles and Rubella initiatives.